All right, so you know that persistent ache you get in your upper right back, right next to your spine, the one that makes you wonder if you slept wrong or if something is seriously like out of whack. Well, today we're going deep into the world of upper right back pain.
It really is fascinating how much misinformation there is out there about back pain.
Oh, absolutely.
So many popular theories that just don't hold up to scientific scrutiny.
Exactly. And that's why we're going straight to the source today. Dr. Strix Toledo, a leading expert in musculoskeletal pain.
You know, his approach is really refreshing.
Yeah.
He emphasizes focusing on what's proven by science, not just popular fads or marketing hype.
I love that he's like cutting through the noise and getting to the heart of the matter.
Yeah.
He actually starts by cautioning us against getting too caught up in those popular cross syndromes.
That's right.
You know, those patterns of tight and weak muscles.
Yeah. He found that relying solely on those as a diagnostic tool can be overly simplistic.
Oh, really?
And even misleading.
So muscle imbalances are definitely a factor.
Oh, for sure.
But they might not be the whole story.
Exactly. It's like focusing on one instrument in an orchestra.
Okay.
You need to hear the whole symphony to truly understand the music.
Okay, so let's broaden our perspective here.
Yeah.
What does Dr. Toledo say about the importance of movement?
Movement. He's a huge proponent of it.
Yeah.
Even more so than just focusing on like perfect posture. You know, he believes that our bodies are designed to move and that too much static posture, even if it looks correct, can actually contribute to stiffness and pain.
So instead of obsessing over whether we're sitting up perfectly straight, we should be thinking about how to incorporate more movement into our day.
Precisely. It's those micro movements, those shifts and adjustments that keep our muscles and joints happy.
That makes so much sense. It's like a car. If you leave it parked for too long, the engine can start to seize up.
Exactly.
You need to take it for a spin to keep everything running smoothly.
Our bodies are the same way. We need to keep them moving to maintain their flexibility and resilience.
This is already shifting my whole perspective on back pain.
Good.
It's not just about finding the right position.
Right.
It's about finding ways to move more naturally throughout the day.
And here's another mind-blowing insight from Dr. Toledo.
Okay, lay it on me.
He believes that musculoskeletal pain often originates from the cutaneous nerves.
Cutaneous nerves.
Yes, those nerves in our skin, rather than from deeper structures like fascia joints or even larger nerves.
Wow. I never would have thought about those as a major source of pain.
Yeah.
Tell me more about that.
Well, traditionally, we've been taught to focus on those deeper structures when it comes to musculoskeletal pain.
Right.
But Dr. Toledo's clinical experience and research has led him to believe that these cutaneous nerves play a much bigger role than we previously thought.
So it's like we've been looking in the wrong place all this time.
In many cases, yes. And it makes sense when you think about it. Our skin is our largest sensory organ. It's full of these tiny nerve endings that are constantly sending information to our brain about our environment.
Okay.
And when these nerves become sensitized or irritated,
Yeah.
they can send pain signals that we feel as a musculoskeletal pain.
Okay. I'm starting to see the connection.
Good.
But how did these cutaneous nerves get irritated in the first place?
Well, there are many potential triggers,
Like what?
including repetitive movements,
Okay.
prolonged pressure, inflammation,
Yeah.
and even stress.
So it could be anything from hunching over a computer for hours
Yeah,
to carrying a heavy bag on one shoulder
exactly.
to just feeling stressed out.
Exactly.
And what's fascinating is that the pain might not always be felt directly at the site of the irritation.
Right.
You can refer to other areas which can make it even more challenging to diagnose.
For sure.
Okay, this is getting really interesting. So if we're not always looking in the right place and we're not always considering the role of those cutaneous nerves, how do we get to the bottom of what's causing this upper right back pain?
Well, Dr. Toledo has developed a really comprehensive approach to both diagnosis and treatment, and he generously shared a specific case study from his practice.
Oh, perfect. A real life example.
Yeah, to illustrate how he puts these principles into action.
Let's dive into that case study and see how Dr. Toledo unravels the mystery of upper right back pain.
He had a patient, a graphic designer, let's call her Sarah,
Okay.
who came to him with that nagging ache in her upper right back, right near her spine. It had been bothering her for months and was starting to impact her work and her life.
Okay. I can relate to Sarah's situation. Spending hours at a computer can definitely take its toll on your back.
Yeah.
What did Dr. Toledo do first?
He started by taking a very detailed history, asking Sarah all about her pain when it started, what it felt like, what made it better or worse, and if she had any other symptoms.
So he was really listening to her experience, not just jumping to conclusions based on her job title or a quick glance at her posture.
Exactly. He wanted to understand her pain from her perspective, not just from a textbook definition.
That's so important. Pain is such a personal experience. What did he find out during this initial conversation?
Well, Sarah told him that the pain intensified whenever she tried to twist or reach for something.
Just normal everyday movements.
Yeah, but they were suddenly a problem.
It's amazing how those small movements can suddenly become excruciating when something's not right. Did she mention anything about her posture?
Well, she did admit to spending long hours hunched over her computer.
Yeah.
But Dr. Toledo wasn't quick to blame her posture for the pain.
Ah, so he was already thinking beyond those traditional explanations.
Exactly. He knew that posture was just one piece of the puzzle. He wanted to get a more complete picture of what was going on.
So what did he do next? Did he do a physical exam?
He did, but before he even touched her, he observed how she moved. He watched her walk, sit, and stand, paying close attention to her overall movement patterns.
So he was looking for any clues that might help him understand the source of her pain.
Precisely, he was like a detective, carefully observing every detail, looking for anything that seemed out of place.
And then he actually examined her back.
Yes, he did a very thorough physical exam, checking for tenderness, muscle spasms, range of motion limitations, and any signs of nerve involvement. He was particularly interested in how her pain changed with different movements.
Okay, so he was trying to pinpoint exactly what was causing her pain, not just treating the symptoms.
Exactly. He wanted to understand the root cause, not just mask the pain with medication or a quick fix.
I love that approach. It's like finding the source of a leak instead of just mopping up the water.
Yeah.
So what did he find during the physical exam? Did he notice anything significant?
He did notice a few key things. First, he found that Sarah's pain was most pronounced when he pressed on certain points along her upper back, especially near her spine.
Okay, so specific points of tenderness, not just a general ache. What else?
He also observed that her range of motion was limited, particularly when she tried to rotate her torso or extend her upper back.
So stiffness and pain with movement, that's starting to paint a picture. Did he mention anything about her muscles?
Yes, he found that the muscles in her upper back and shoulders were quite tense, almost like they were in a constant state of guardedness.
I bet that contributed to her limited range of motion. It's like those muscles were holding her back. Literally. Did he suspect any nerve involvement?
He wasn't ruling it out, but the way her pain changed with movement, especially those specific points of tenderness, made him suspect something else: facet joint dysfunction.
Facet joint dysfunction. Remind me what those facet joints are again.
Think back to that Lego analogy we talked about earlier. Those facet joints are the little connectors that allow the vertebrae, those Lego blocks of your spine, to move smoothly against each other.
Right, they're like the hinges that let our backs bend and twist. So what happens when those joints go haywire?
Well, when they get inflamed or irritated, it can cause pain and stiffness, especially with movements that put stress on those joints, like twisting or extending the back.
Okay, that makes sense. And that seems to fit with what Dr. Toledo observed. In Sarah's case, her pain got worse with those specific movements.
Exactly. And the location of her pain right near her spine also pointed towards those facet joints.
So he was starting to put the pieces of the puzzle together using those specific clues to guide his diagnosis. But did he jump to any conclusions?
Not at all. Dr. Toledo is incredibly thorough. He wanted to rule out any other potential causes before settling on a diagnosis.
So back to those detective skills again. What did he do to confirm his suspicions about those facet joints?
He decided to do a couple of diagnostic tests, starting with an X-ray.
So he wanted to get a visual of her spine, see if anything structural was going on.
Exactly. The X-ray can show things like fractures, arthritis, or any major alignment issues that might be contributing to her pain.
And what did the X-ray show?
It didn't reveal any major structural problems, which was good news, but it did show some minor degenerative changes in her facet joints, which supported his suspicion of facet joint dysfunction.
Okay, so the X-ray provided some valuable information, but Dr. Toledo wanted to be absolutely sure before making a diagnosis.
That's right. So he decided to do one more test, a diagnostic injection.
Diagnostic injection.
Yeah.
What's the purpose of that?
It's a way to pinpoint the source of pain with incredible accuracy. He injected a small amount of anesthetic directly into the facet joint he suspected was causing Sarah's pain.
So if the anesthetic numbs the pain, then he knows he's found the culprit.
Exactly. It's like a magic bullet that silences the pain signals coming from that specific joint.
Wow, that sounds like a powerful tool. And did it work? Did the injection relieve Sarah's pain?
It did, almost immediately. The relief was so significant that it confirmed his diagnosis of facet joint dysfunction without a shadow of a doubt.
Okay, so now he had a clear diagnosis, but I'm guessing that was just the first step in her journey toward recovery.
Yeah.
What did he recommend for treatment?
Dr. Toledo's treatment approach is incredibly multifaceted. He believes in addressing pain from multiple angles, not just relying on one single solution.
So a holistic approach, as we talked about earlier, what did that look like for Sarah?
Well, he started by explaining to her exactly what facet joint dysfunction is, how it can cause pain, and what she could do to help manage it.
So he was empowering her with knowledge, helping her understand her own body and her own pain.
Precisely, and that understanding is so crucial, it helps reduce fear and anxiety, which can actually exacerbate pain.
I can see how feeling informed and in control could make a big difference in her recovery. What else did he recommend?
He created a personalized exercise program for her, focusing on improving her spinal mobility, strengthening her core muscles, and stretching those tight muscles in her upper back and shoulders.
So a combination of movement and strengthening, which aligns perfectly with his philosophy of prioritizing movement over static posture.
Exactly. And he also incorporated some manual therapy techniques like gentle mobilization of her spine and soft tissue work to release those tight muscles.
So he was addressing both the structural and muscular components of her pain. Did he mention anything about those cutaneous nerves we talked about earlier?
Yeah, he did. He actually used a technique in manual therapy to address any potential sensitization in her cutaneous nerves.
Manual therapy for cutaneous nerves. What does that even look like?
It involves gentle hands-on techniques that help to desensitize those irritated nerve endings. It's like calming down those overactive pain signals.
Okay, so he's addressing her pain from all angles, the joints, the muscles, and even those tiny nerves in her skin.
Exactly. And here's what's really remarkable. Sarah started to feel relief almost immediately. Her pain levels decreased significantly, and her range of motion started to improve within just a few sessions.
Wow, that's incredible. It sounds like Dr. Toledo's approach really worked for her.
It did, and what's even more impressive is that he didn't just focus on treating her symptoms, he empowered her to take control of her own health, giving her the tools and knowledge she needed to prevent future episodes of pain.
So it wasn't just a quick fix, it was a long-term solution.
Exactly, and that's the beauty of his holistic approach. It's not just about eliminating pain, it's about helping people live healthier, more fulfilling lives.
Well, this has been an incredible deep dive into the world of upper right back pain, and especially the importance of understanding facet joint dysfunction.
It's amazing how much we can uncover when we really take the time to delve into a single case and explore those underlying mechanisms of pain.
And what I love about Dr. Toledo's approach is that he doesn't shy away from challenging conventional wisdom. He's constantly seeking new knowledge and refining his understanding of pain, and that's incredibly inspiring.
Absolutely, and that commitment to ongoing learning is what sets him apart as a true leader in the field.
Okay, so we've learned a lot about facet joint dysfunction, but Dr. Toledo also highlighted some other potential causes of upper right back pain, things that might not be as obvious, but are equally important to consider.
That's right, and I think it's time we explore those next.
All right, let's do it. We'll be back after a quick word from our sponsors to delve into those less common, but often more complex culprits behind upper right back pain. Okay, so we're back and ready to venture beyond those usual suspects of upper right back pain.
It's important to remember that we shouldn't underestimate the role of nerve issues.
Oh, really?
Yeah, they can be quite tricky to diagnose.
Yeah.
Because the pain often doesn't behave the way we expect.
Okay, nerve issues. That sounds a bit intimidating. Can you give me an example of what that might look like in the context of upper right back pain?
Sure, let's talk about thoracic radiculopathy.
Thoracic what?
Radiculopathy, it's a mouthful. I know, but it simply means a pinched nerve in the upper back.
A pinched nerve? Okay, I've heard of that happening in the neck and lower back, but how does it happen in the upper back?
It often stems from a herniated disc. Remember those jelly donut-like discs that cushion the vertebrae in your spine?
Oh, yeah?
Well, sometimes that jelly filling can bulge out and press on the nerves exiting the spinal cord.
So it's like a traffic jam in your nervous system. Yeah, those pain signals can't get through properly, and that's what causes the pain.
You got it. And here's the thing that makes thoracic radiculopathy so tricky. The pain doesn't always stay in your back. It can radiate along the nerve's path, sometimes traveling down the rib or even into the chest.
Wow, that could be really confusing. I can see why someone might mistake that for a heart problem or something else entirely.
Exactly. That's why it's so important to pay attention to the specific characteristics of the pain. With thoracic radiculopathy, it's often described as sharpshooting or burning, and it might be accompanied by numbness or tingling in the affected area.
So those distinct sensations can be valuable clues for a doctor. What about that other nerve issue you mentioned earlier, intercostal neuralgia?
Yes, intercostal neuralgia. This one involves the nerves that run between your ribs. When these nerves become irritated or inflamed, it can cause intense, sharp stabbing pain along the rib cage.
Ouch, that sounds incredibly painful, especially with everyday movements like breathing or twisting.
You're right. Even simple actions like taking a deep breath, coughing, or laughing can trigger those sharp shooting pains.
This is all reminding me of how interconnected our bodies are. We talked about those cutaneous nerves earlier, but it seems like the nerves deeper inside us can also wreak havoc when they're unhappy.
Absolutely. It's like a complex network of wires sending signals throughout our bodies. And when those signals get scrambled or disrupted, it can manifest as pain in all sorts of unexpected places.
Okay, so we've covered nerve issues. What else should we be thinking about when it comes to those less obvious causes of upper right back pain?
Well, Dr. Toledo reminds us that sometimes the pain we feel in our back isn't actually coming from our back at all. It's referred pain originating from a completely different part of the body.
Referred pain, that's like our body playing tricks on us. Can you give me an example of how that might apply to upper right back pain?
Think back to that case study with Sarah, the graphic designer.
Yeah.
Dr. Toledo actually considered gallbladder disease as a potential cause of her pain, even though her symptoms seemed classic for facet joint dysfunction.
Wait, gallbladder issues can cause upper right back pain. How is that even possible? Those seem so unrelated.
I know it sounds surprising, but pain in the right upper quadrant of the abdomen where your gallbladder is located can actually radiate to the back, especially near the spine.
So if my upper right back starts aching after a greasy meal, it could be my gallbladder sending out an SOS.
It's definitely something to consider, especially if you have other digestive symptoms like nausea, bloating, or indigestion accompanying the back pain.
Wow, this just highlights how crucial it is to look at the whole picture when it comes to pain. It's not always a straightforward answer.
Exactly. It's like solving a mystery. You need to gather all the clues, consider all the possibilities, and then use your deductive reasoning to figure out what's really going on.
And that's where having a skilled and experienced doctor like Dr. Toledo makes all the difference. He's not just treating symptoms, he's looking for the root cause and considering all those interconnected systems in the body.
You said it's that holistic approach that sets him apart. He's not just trying to mask the pain. He's empowering his patients to understand their bodies and take an active role in their own healing journey.
Well, this deep dive has been incredibly eye-opening. I feel like I have a whole new understanding of upper right back pain. It's not just about muscle strain or bad posture. It can involve those tricky nerves-referred pain from unexpected sources and even those cutaneous nerves we often forget about.
And what's most important is that we've learned to question those oversimplified explanations and to look beyond the obvious when it comes to pain. It's about embracing complexity and seeking a deeper understanding of how our bodies truly work.
Exactly. And as Dr. Toledo reminds us that understanding is constantly evolving, we need to stay curious, keep asking questions, and be open to new ways of thinking about pain.
It's a lifelong journey of discovery, and it's one that we can all embark on. So to all our listeners out there, remember, don't settle for quick fixes or simplistic explanations. Dig deeper, challenge assumptions, and empower yourself to take control of your health.
Beautifully said, and thank you for joining us on this deep dive into the fascinating and often misunderstood world of upper right back pain. We hope you've gained some valuable insights and are feeling inspired to take a more proactive approach to your own health.
We'll see you next time for another exciting deep dive into a topic that's sure to spark your curiosity and expand your knowledge.